because a lot of the data says we learned from the Women's Health Initiative that estrogen drives cancer and women should not be on it.
Yeah.
But if you really look at the literature, so why did we do the Women's Health Initiative? We're an aging nation, and they say by 2030, the majority of us will be over 65. So the United States was trying to figure out a way to not topple Medicare. So 40 prestigious institutions such as Harvard and Fred Hutchinson Research Cancer Institute, they got together and they looked at women every which way. And one of the very first studies they did was on hormones. Hormone replacement began in England in the mid-1950s, and it really picked up speed. And women did so well on it clinically that in Britain and then the United States started to do hormone replacement, although we did more synthetic forms of hormone replacement than England did. We started to give it to people after they had stints, after they had heart attacks, if they had congestive heart failure. They used it as an adjunctive care for adverse cardiovascular issues. If you had heart health issues, they gave women estrogen, and women seemed to do really great with it. They did not seem to have an increased incidence of breast cancer. So they said, let's run a randomized trial in this Women's Health Initiative, looking at how to keep women healthier longer and not topple Medicare. Let's run a trial on estrogen only, and then let's run a trial on the most common way that estrogen at that point in the 1960s and all the way up to the 2000s, estrogen was most commonly prescribed in the United States as a combo product. It was horse equine estrogen called conjugated equine estrogen or Premarin, combined with a synthetic progestin, medroxyprogesterone acetate. And together they were called Prempro. Prempro was the bomb. Everybody was being put on Prempro. So they said, let's do an arm with just the estrogen, which was from a horse, and women swallowed it. And then let's do another section of the study, which is part of the study is called an arm, and we'll give those women Prempro. And they were going to put women on these hormones for 8 years and track them. And this is where we all got derailed. So the women on the Prempro arm, within a few years, started to look like they had more clots and adverse heart issues, but they also looked like they were having more breast cancer. So that arm, the Prempro, the combo arm, was stopped. Yeah. The estrogen-only arm was not stopped. It went on a few more years, and it was only because there was a slight increased risk of ischemic stroke and clotting, which we know you get if you swallow hormones and don't put them on topically or vaginally, because the way you get them in your body makes all the difference. It was stopped a few years later, but the estrogen-only arm was never found to have an increased incidence of breast cancer, ever. In fact, they did sequential reanalyses of the estrogen-only arm at 3 years, 5 years, 10 years, but they published the huge final reanalysis in 2019. They presented it at the San Antonio Breast Cancer Convention. Every year in San Antonio, here in Texas, they get together in December and they have a big breast cancer symposium. And they take a look at all the researchers get together, and there they had a reanalysis of the Women's Health Initiative. It was almost a 20-year reanalysis. And the same authors of the Women's Health Initiative, the very original authors, if they were still alive, they said, we have found that if women were on estrogen for an average of 5 years, they had a decreased incidence of breast cancer by 23%. That means your risk of getting breast cancer was reduced almost by 25%. And if you were on estrogen for an average of 5 years, estrogen replacement, and you ended up by some tragic event getting breast cancer, you were much better off. Your fatality incidence was decreased by 44%. Nothing has ever been so breast protective. And Leon Spiroff, who wrote, you studied Leon Spiroff's books. He's written all the gynecology textbooks for docs and gynecologists, for everybody. He started pumping out within a few years of people saying that estrogen caused breast cancer. He said, no, you're throwing the estrogen baby out with the bathwater. We've only seen protection. You're getting this all wrong. Naftalin from Yale was a major statistician who republished early on. That's why I wrote the book, Safe Hormones, Smart Women, because for some reason, people have been evaluating the Prempro arm, which was the progestins in that arm, as causing breast cancer. And this is what drives me absolutely crazy. A lot of times you'll hear there was just a study a week or two ago, and one came out in Sweden, and it was published in the British Medical Journal, and they said hormone replacement causes dementia. Well, but if you look, it's got synthetic progestins added to it,
Yeah.
or it's horse estrogen, and it's oral and it's swallowed. So what a hormone is added to and how you take it into your body makes all the difference in the world. But somehow this message isn't getting out, and women are really missing out. And even triple negative breast cancer, where women aren't ER positive, PR positive, or HER2 positive, they should be able to be on hormones. For sure they should. They don't even have any hormonal receptors on their tumors. If you're a high-risk woman, you are denied hormones because they've stopped teaching hormonal menopausal medicine. And for gents, the same exact thing, andropausal medicine in med schools and in naturopathic schools and in osteopathic schools. So now when most average patients go to a regular doc and say, hey, doc, I'm getting kind of tired. I'm gaining a little mid-weight. I have a little bit more brain fog. I'm not the me I used to be. Do you think I should consider hormones? Most of the time they get a wrong answer because the doctors have been told that hormones drive cancer. So there's this huge misconception, and women miss out.